Excellent. So we'll go ahead and get started unless anyone else has a quick suggestion, quick question.
Yes, Dr. Chuckalingam. Welcome everyone to MSMA's and MU's Wellness Series. We're glad to be hosting it. I'm Director of Communications for MSMA, and in my office this morning I have a guest, Dr. Laurel Kramer, a PhD psychology who works with St. Mary's here in Jefferson City, and so I have invited her to attend as well. Laurel, did you have something?
Yes, I did. As a psychologist, and I work within the healthcare system, I often talk with physicians and healthcare workers, obviously, but the thing that concerns me for physicians burnout, especially this last year, even though they talk amongst themselves and they try to do the wellness for their patients, they often don't do it for themselves. And some of it, I think, is just the nature of the work that we do. But I think it is important to have some way for just mini stress busters during the day. I know some physicians have told me who have been in practice years and years and learned this method. Oftentimes they'll take a 2-minute break in the middle of the day and at the end of the day to just do a mini meditation and de-stress themselves and let go of all the negativity that they've collected. So when they go home, they can reboot for the evening there. They've also really struggled with taking work home, whether that's because they've had a lot of patients die, especially in 2020. It has really weighed on them because they look at themselves as healers. And so when the pandemic came and so many patients were dying one after another, it really hit them hard. And they are still, it took them 6 months to really regroup, or 4 months, and many of them are still regrouping now from the onslaught of the loss in November and December. So I think there's little pockets that I don't know if it's in education, teaching our younger physicians to do self-care, but it's definitely in the working world and in that pressure cooker of office visits, productivity, and the hospital environment. So I just want to get some ideas maybe to disseminate to the people that I work with, the physicians I work with today.
So glad you joined us. So I'd love to hear from you, your thoughts on how we can get this message to more people. And we'll go ahead and get started. Shall I share some slides? One thing I thought is it's already close to 9:15. By 10 o'clock, we can sort of officially end it, but people, if they have questions, I'm here longer in case we can leave the session open. Is that a possibility, Liz?
Yes, that's good.
So that we can continue the sort of informal discussions even afterwards.
Yes.
Do you see my slide as a full screen?
Yes.
That's great. So understanding burnout in 2021 and how doctors can fix this ourselves. So that's what we're going to have an overview on today. My disclosures are highlifejourney.org, which is a nonprofit trying to help doctors, patients, even school children get online and learn some of these very intuitive, mindful methods and get better on their own. They don't need to come to see us or connect with us in these formal sessions. Seeking Hunger is a very small 1-hour read. It's a small book that we just wrote a couple of months ago. And it's trying to tell people how to, why we should stay hungry and connect with our health directly. So today we want to discuss what is burnout, its prevalence, the current evidence, and what are the system issues and the self-inquiry, how it can make a difference. First, to understand its prevalence, this is the breakup. The most recent analysis that we have says more than half critical care providers are reporting burnout, followed by infectious disease, rheumatology, urology, and pulmonary medicine being the top few specialties. Cardiology is somewhere in the middle, and gastroenterology is at 40%. And least burnout we see among oncology, plastic surgery, dermatology, and Earlier, it used to be preventive medicine, but there are some specialties that have gone even lower with burnout in the last couple of years. So what do we mean? What contributes to this? Internists are saying, I'm working 6 days a week, nights, weekends, and holidays, just don't have time. General surgeon feels they are forced to see 4 patients in an hour when they are complicated and several procedures are involved. ER doctors are saying there is a dangerous lack of timely personal protective equipment, especially in the COVID world. It's such a huge challenge. Then, how has burnout affected doctors' life? I get angry easily. I dread every shift. I'm frustrated and cynical about patients. I find myself becoming a doctor and person I don't want to be. OB-GYN is saying, I often feel despair. I have severe anxiety and PTSD. I have severe self-doubt, and I have lost the strong sense of self and values that I once had. A psychiatrist says, I'm tired and discouraged. It stresses my marriage. I have a hard time getting out of bed in the morning. I count the days until Friday. When we actually measure depression, 20% of clinicians already have depression. On top of that, another 70% have colloquial depression. They just feel down, they have the blues, they feel sad, they're not happy people. 11% have other manifestations. When physicians describe their depression, I'm gaining weight, I'm angry, and not sleeping, says a ER doc. I can't do the things that I enjoy to relieve stress, such as traveling. My hair is falling out because I can't de-stress. And then a neurologist says, I'm now on depression medications. My depression and anxiety are hurting my work and personal relationships. So this is what doctors in different fields are facing in 2021. We know that even if you look at suicide rates, it's 3 to 4 times higher compared to the general population in the United States, where it's about 12%, and it is close to 12 per 100,000, and it is nearly 28 to 40 suicides per 100,000 doctors. So doctors have more risk than the population that we are treating. And what does the current evidence say? Physician burnout is a significant problem. Exercise, good nutrition can significantly help physicians cope, and addressing emotional energy is important. So how do we do these last 2 things? Sleep, you'll be surprised, is such a key thing. The interventions to promote healthy sleep may reduce burnout susceptibility and improve resilience. Professional coaching may be an effective strategy to reduce burnout and improve well-being. So going to a psychologist, do not blame the burnout on physicians. Instead, address the working conditions. So how much is this environmental or systemic issues? So if you look at what is burnout, how do we measure our energy or resources, then it breaks up into 3 components: emotional exhaustion, depersonalization, and sense of low personal accomplishment. So all these 3 are very key in bringing about this burnout phenomenon in doctors. This came to light, I think, primarily because people in administration figured it will help the system do better, not only to focus on patient care and lowering costs and better outcomes, but also on physician wellness. So this is how this has come about originally. But now with more and more awareness, doctors are looking within themselves to figure out, okay, I need some more self-time, some more focus on my own health so that I can continue to stay healthy and do everything else that I want to do with my life. So I personally feel, and many people who have worked in this area feel, that 80% of the issues that doctors end up having to cope with are systemic. And it's related to external factors that are outside our direct control, which means in today, next Saturday, and the Saturday after, whatever we discuss is not going to touch 80% of the problem. We are only going to focus on the 20% that we can fix. In that, specifically, how mindfulness and a process we call self-inquiry. That word itself, we're going to understand a little more in the next few minutes. These, I believe, can take us significantly forward towards better health and wellness. So what are the causes for us being here overall? The culture of medicine has changed dramatically in the last 3 decades. Electronic medical records, work environments becoming more chaotic, lack of control over our own schedules, insufficient time, having to take work home, and then less decision making by the doctors and misalignment with our values are all major issues. And this slide is specific to the US. And for people from India, they may feel, oh, I'm still in control. But unfortunately, whatever is happening in the Western world is also happening with a 1 or 2 decade lag in the developing world. That's what we see in so many other spheres. And there's a high likelihood that this type of centralized medicine is going to make our life in other parts of the developing world also a challenge in the coming decades. So we said 80% is system issues. And this was a very nice paper that looked at why we are doctors in the first place. We love to have control over our lives. We want to feel that we are in charge. And how can we become in charge of our lives? Because we trained 15, 20 years to be doctors, and to become good at it, it takes longer. So that much we've dedicated our lives to this profession, so that autonomy is sort of something that is ingrained in our expectation of practicing medicine. And competence comes automatically from that many years of training and our dedication. And that relatedness, what are we doing this for? That connection every day. Because if you look at the 40-hour work week that most other professions are expected to sort of do, 9 to 5 jobs, we are by and large all along doing more hours, more weekends. And we don't see that translated into monetary benefits. So we expect it in some way to, we have to account for it somewhere. So that's where the challenge is. All these 3 things are now in question in this last few decades where medicine has gone in the US. Now look at it from the other perspective of the patient. The same heartburn medicine, Nexium, in the Western world, I'm not bringing cost from Africa, India, or China, only in the Western world, England, Spain, and Switzerland, it costs about $40, $50. In the US, it is 4 times higher. The exact same medicine. So this is the, in one picture, I'm trying to show how much challenge patients are facing in dealing with our healthcare system. So they're going to, that's going to rub off on the doctors who provide care. This is another aspect of the same story. US citizens travel to Mexico to get a lot of their healthcare already. 1 million citizens have done this already. Like savings can be 50, 60, 70%. A lot of dental care and some orthopedic bariatric care and infertility care, all this is already being provided by physicians in Mexico. This is a nice read that will give you some insight into why in the last 2-3 decades, healthcare has dramatically changed in the US. The price we pay is written by Dr. Martin Macquarie, and you will find that it's a very good resource. This is another look at the challenges that doctors face within the US system. Dr. Hagen was asking why doctors now are feeling more stressed. This may be one of the answers, because compared to the 1970s or 1980s, the brown, the graph that you see is the number of physicians. It has gone up by about 50%, maybe 100%. I don't know. In this big graph, it's barely out here in the corner. But when you see the administration, in the last, especially since 1990, with some changes in healthcare policy, it just has shot up so high to the point that there is a 2,000%, 3,000% increase in administration. So that is felt by patients, but mostly by doctors. We have to answer that many more questions in each and every decision that we make, every patient that we take care of. So many more levels of oversight is now involved compared to just a few decades ago. This is a very, very good friend of mine, Dr. Leslie Anand. He's no more. He suffered from very rare type of cancer, and we lost him only a few months ago. When I presented this Heartful Living Burnout series last summer, he came, discussed the challenges doctors in India are facing, and what he brought to us was, despite all these personal issues, he's continued to work despite having stage 4 cancer. And he said, your doctors in the US are struggling with the challenges with medical records. For us, if there is a complicated patient who dies, then we have to worry whether we are going to be physically assaulted. That risk is still there in so many parts of Indian medical care. So that's the challenge. Doctors are at risk of being assaulted. Their life is at risk if a patient's not doing well. So this is Albert Camus. At the time of World War II, when France was occupied, he says, in the depth of winter, I finally learned that there was in me an invincible summer. And I'm going to stop here. If someone wants to tell me in their life that they find this to be true, I want to hear about it if you're willing to share with our group today. You'll have to unmute yourself if someone wishes to tell us anything. If nobody is unmuting, that probably means I put many people to sleep. So none of us agree that this is even possible to experience summer in the middle of a snowstorm. Albert Camus quote, he died in his 40s after winning a Nobel Prize for literature. But the reason he was able to say something this profound is because life was a huge challenge under German occupation in the 1940s, in the middle of World War II. People were struggling, and that's when he found that much strength. We don't have that much of a challenge. We are actually living in one of the most peaceful times that humanity has ever known. COVID has really brought about a lot of challenges. So many of our people world over are struggling, but still we are not in war yet at a big scale. So to find that much confidence, I believe we have to go that far deep within our consciousness. And that's what he has done. So that's what is self-inquiry. So that is what we have actually, I've not heard this Albert Camus saying until only very recently. That's why I added that slide. But that's what we've been doing through Heartful Living, the program we've had for the last 6 years, showing people the temperature is not what the weatherman tells us. Outside temperature is mostly determined by our inner energy. That's what you're going to see next in the few slides. This is a patient. What I try to show in these are all medical records of patients that I just bring without any identifiers. Here you'll see the date, 2019, throughout 2020. This is the weight in kilograms. This patient was excessive weight, but she also had multi-organ failure. In the sense, heart, had procedures, diabetes, cirrhosis, significant GI bleed requiring transfusions, atrial fibrillation, pulmonary hypertension, kidney disease. So we know as doctors that when so many vital organs are not doing well, people don't survive. But she did dramatically well for 5 years despite all these challenges. We say health is not just your ability to walk on the treadmill. It is our ability to perceive, health is freedom to pursue life passionately. This is how we start Heartful Living series for patients with this many comorbidities. This is what she said at 69. With all these problems, what do you feel grateful about?
That I wake up every morning.
Excellent. You started out saying that you're an optimistic person.
I've always been optimistic and always figured I had at least the glass half full.
Now, how do you look at your life?
That my glass is always full and overflowing.
What do you feel? So how did she get there, where she is saying the glass is totally full? How much self-confidence has she gained? So that, I believe, is an example of what Albert Camus has said. She has found that confidence, optimism, and energy, despite all these problems. And on top of it, when she recorded this, it was on the telephone because she could not come in due to multiple vertebral fractures that happened spontaneously. So being bedbound, she has this much optimism, saying my cup is not half full, but it's totally full. And she attended our series, I think, in 2019 or 2018. And after that, she has remained this optimistic. So this is possible for heart patients. This is another very good classmate, friend of mine, who went to medical school with me. She woke up in 2016 and found her husband was not waking up. He had died of a coronary event in his sleep. She was 42. She had 2 teenage children. You see in the picture, this is her and this is her husband who we lost. And she has been sedentary until this point in 2016. She was a doctor working hard, and her life was just taken a huge negative turn. But fast forward to the present time, she's working much more efficiently. She's remaining single, but feels so fulfilled in her life. Her kids are doing really, really well in school and college. And the important thing is, in these 3 years, she has learned to swim, competitively bike, and run. And now she does triathletic events in Chennai, India, despite being a full professor and being a single mom. So this is what a physician can do out of their regular day. And she did it not out of her regular life. She did it when she was pushed with losing her husband. And she shares these success stories to inspire the other 150 of our classmates who went to medical school with her. And she said, please share it with your doctor groups so that we can inspire more people towards health. So her message is, she went to Thailand last year for 10 days of biking. In her mid-40s, she said is her first trip for her own health and well-being. So at mid-40s, if we can take a 1-week trip where we do biking with like-minded people for a week, I think that gives us confidence to move through the whole year and look forward to the next year when we can do something else like that for ourselves. She sent this picture, I think, a year or 2 ago, and still I haven't done my bike trip. I love biking. It's just that life is busy. My request is, family is very important, job is extremely important, but find a hobby that is so important, so passionate, and so fun for you. And preferably, as a cardiologist, my request will be, if you can find a hobby that involves your body also, then you hit the sweet spot towards much, much healthier life, all lifelong. Now we'll come to a professor here at MU. At 69, he had a coronary event and required a couple of stents. And walking in Walmart, he would get short of breath. At 69, he did our cardiac wellness program, completed cardiac rehab, and then he went on to exercising more to the point that he did a 5K race. And in 6 months, he brought, after the MI and stent and cardiac rehab, he brought back this medal to our next session to inspire the next group of cardiac patients so that they can do better with their life. So we are moving from the lowest end when people are stressed, depressed, anxious that their heart has taken a hit and they've got a surgery or stent, and whether they might even return to their life. He has returned to his life, and then he has done so much more. And this HPI is Human Performance Institute. It's part of the University of Missouri. And what he does there is he goes and trains with the school and college athletes who are competing. So he's building more muscle at 72. So this is not something as a cardiologist I'm recommending. He's doing it because this has become who he newly is. This new definition of himself in his subconscious or conscious mind is so enthusiastic that he's pursuing even higher athletic things 3 years down the road. So that brings me to a beautiful research and book written by Mihai Csikszentmihalyi in 1975, The Flow Experience, and this has created a new field of positive psychology. I've used these concepts now for 6 years with our Heartful Living programs, and this book is an amazing read. The reality is we all can become more connected at a deeper level. That's what this book says. And this is the way we can do it. We can engage optimally with what we are doing, free of self-consciousness, and enjoy every day. And when we are engaged in what we are doing, at the end of an hour, we'll feel as if only a moment has gone by. So how do we do this on a routine basis? There are some ways to get in there. First thing is we have the x-axis is our skill or experience. So if you take, for instance, tennis, which I love to play all my life, I've been playing it for so many years that my skill would be somewhere in the middle because I've enjoyed it and played it. So if I was to play tennis with somebody who's never been on a tennis court, and the challenge that I face is very little, I'll be bored. But if I were to play with a professional player, I'll be very anxious not to look like a fool on the tennis court. So I'll be mostly anxious. What if I found a person roughly my age, my skill, and my level of interest? There is 1 in 10 chance only then to enter into flow. So even then, 10 days that I go out on the tennis court, there's only 1 out of 10 chance that I may enter this flow. Once I do that, the next 10 times it'll be so interesting for me to go and try. This is more than addictive. It is such a deep experience. It makes life itself fulfilled. That is the flow that in 1975, Mihaly Csikszentmihalyi researched and wrote this beautiful book on. And I feel this patient, when he wins this, that's where he is, not in the moment, but on an everyday basis, 24/7, he's entered that level of deep flow. And for that, the stenting and the heart attack all inspired him. That was the challenge. And he continued pushing his body. And now he is lost a lot of inches, and he feels first time he's fitting into a 34-inch pant, and this is in 25 years he's not been able to lose that much weight. His blood pressure is less than 120 millimeters mercury without many medicines, and he feels so proud that he's not needing these medicines. And this is the email. He looks at me as a running coach, but I don't run myself. I'm not an athlete. I love to play tennis. I inspired him in finding his own spark in fitness in his 70s. So that brings us to what do we actually do to our patients in this program. And now, these are different things we teach: diet, exercise, stress reduction, mindfulness, all these things. And this is what we find happens to our patients since 2015. People become much more resilient. This is the most important thing. Resilience is the opposite of burnout. The resilience means we can cope with COVID, we can cope with the next challenge or whatever else life throws at us, which we don't know what's around the turn. And we start liking using our body. It happens intuitively. And people on medicines find they need much, much lesser medicines. There is so much weight reduction that can be achieved. This 20 is just a number I wanted to leave. People have lost much more weight than that. And diet, we can find, can help us gain a deeper insight into ourselves, gain more years to our life, and most importantly, add more life to our years. And all this that I talk about is at zero effort. So that's where the magic starts. So what causes burnout? Too many bureaucratic tasks. That's the number one reason people are quoting. Too many hours spent at work. And lack of respect from administration. These are the 3 top reasons people report as reasons for burnout. And how do we cope with it? Doctors say the biggest way they cope is with exercise and connecting with people in their lives and finding quiet time. These are the 3 biggest ways. And how do we stay happy? Doctors, 2/3 of them feel finding a hobby helps them. Exercising, again, they feel equally is important. And family time. These are the 3 things that many, many doctors feel is helping them. So in self-inquiry, what we teach is positive psychology. We teach meditation. We teach 5,000-year-old Siddha medical techniques. Siddha is the Tamil Indian medical system. And it gives us some such valuable insights that are timeless and still in this day and age so useful. And I bring to the table whatever latest cardiology evidence there is. In cardiology, I should add anti-aging research. That's been a separate field that I'm only exploring in the last 3 to 5 years. But that research is about 60 years at least. And they've shown so many benefits with how we can slow aging and in many instances even reverse aging. So that's what we do, how to improve health span. And humans, the word Homo sapien means we are wise, we are self-aware, we are free. And that means we should celebrate life. So this is implied at our birth. So we have to find ways to be happy and free, no matter what our circumstances. That's what that invincible summer is all about. So we started High Life in 2020 online. So all this is recorded and available on our website for free for anybody, anywhere in the world. Heartful Living, the patients have actually taught me that they do so much better than we actually predicted 5 years ago. And the first thing we start with, and today we will start with this, that is smiling 20 times. Now I'll take a quick pause. Everyone, you can smile at your home. You don't need a reason, just smile. So that smile that we just did may not need a logical reason. You will find in the next 2 Saturdays that much of what we do does not have to make logical sense. We are much older than our logical mind. We are millions and millions of years old. Our logical mind came about only about 300,000 years ago when the first man walked on this earth. So I'm not against logic, but I want you to explore your own reality as an inner experience rather than just through your logic. When you smiled just now for my sake, I'm pretty confident many of you would have found some reason to smile. Can anyone tell me some silly reason that you came up after I forced you to smile? Anyone wants to unmute yourself and share with me that experience? You just smiled 30 seconds ago. I'm telling one of you at least would have come up with some logical reason for having smiled.
I just looked at your smiling face.
Okay, excellent. That's a good reason. Why I ask that is the logical mind is so sharp. That's the only way I'm talking to you today. And that logical mind wants to make sense. We don't need to make sense. That's what you're going to learn in the next few weeks. But in that process, the logical mind will still find so many reasons why we smile. That's beautiful too. It's okay to have a reason, but it's okay not to have a reason also for the smiling. So then we go to yogam or oli, which is the real passion for life itself. That's been around in Siddha tradition for 5 to 10,000 years. And we call it yoga, we call it kung fu, we call it Zen, Japanese philosophy, so many different names, but many of these things are attributed to Siddha philosophy if you go to the roots. And then, as I told you, we've been around for 300,000 years. I want you to connect with happiness that is even older than that. How do we do that? Not through learning more and more at the conscious level. The conscious mind, everything I know about myself, that I'm a cardiologist in Missouri, and today whatever I know about tennis or anything else, my family, everything is in the top 10%. But 90% of my consciousness is at my mind is at the subconscious level. It is not easy for us to tap into that. The reason for that is logic, thinking, and willpower all reside in the top 10%. There is an actual barrier that limits our view and our ability to tap into our own subconscious reserves. And what is that barrier? Again, that barrier is our training habits. And subconsciously, there are so many emotions that lead to our choices and habits, our values. All these things are at the subconscious level, but the most important thing that we will again and again tap into today and the next 2 sessions will be our gratitude and our creativity. Once we connect at that level, that is where the magic starts. So I said there is this subconscious, but at the heart of it, at the core of the subconscious, we can use the simple framework, H for humility, E for being empathetic towards others around us, A for our own aspirations, goals, dreams, every day, connect with it. And R is reciprocating, giving others the benefit of doubt. With these 4 things, the T happens automatically. Trust in our system, trust in our colleagues, trust in our family, and most importantly, trust within ourselves that we can do better. So that all this happens intuitively at the subconscious level. And that's when our patients are getting better. The conscious mind says, I'm struggling, I'm working too hard, my job is stressful, I'm burnt out. That's because of so much specialization that has happened in the last 10,000 years. Before that, we had plenty of leisure time. We all the time were pursuing routine life. Our ancestors did not look very fancy, but they had I would say, a more balanced life. So This is our website. I invite you all. We actually wanted to invite you to sign up to High Life Journey. It's free. If you put in your information for 5-10 minutes, in 3 months, you can re-look at yourself, how your mind is looking at life differently. So that's why we want you to, not only the mind, but also the 10-year cardiovascular risk, all these things we can assess and help us make this programming better for you and do some big data look at these outcomes. But for you, within 3 months, hopefully you'll be able to see some improvement in your level of anxiety, stress, and your confidence. That's what we want to show you. So this is the book where I just look at this cup as being totally full and overflowing. And so many of our patients in the last 5 years have come back and said, yes, doctor, my life is turned around. So this is a pretty involved slide where we start with the high life, with deeper self inquiry, and we connect with the mind and our mind's challenges. Then every person we have to connect with our body. Even my 80-year-old patient with one leg and low back pain and a stroke, they still do physical exercise. How do they manage it? By upper extremity exercises. Some way we want to involve the body as best as the body can participate. I feel that's very important. And then exercise. Can we mute yourself, please? And then diet. There is so much we can talk about in diet and connecting with the people in our life, and then finding that all this improves our confidence and makes us enjoy today. So self-inquiry starts with smiling. I requested you to smile with me today, but now I'm going to place the next biggest challenge or request or whatever you want to call it, is to smile 20 times every waking hour. Some people say, doctor, you're asking too much. People will think I'm silly if I keep smiling when I'm working. I'll retire and then I'll sit around and smile. No. Other than every other profession, we have to smile more, whether we have a reason or no. The thing behind the smiling is it breaks the connection between the stress and our heart. I've done work on Takasubo stress cardiomyopathy for the last 15 years. The scary part of it is at least a third of it comes from mental stress. In this COVID world, there is so much more challenges financially and emotionally, and work, loss of work, and losing close family members. Earlier, just 2 years ago, when somebody in our family dies, we could be around with them to give them support, to give ourselves some peace of mind, near and dear ones. But now in this COVID world, so many people can't even see their own family for days, weeks, and then they end up losing them. So it's a very challenging world we live in. Still, in this second surge of COVID in India, as of April 2021, I'm still requesting you to smile 20 times every hour. So that is the self-inquiry, that is the meditation. And the word self-inquiry means asking profound questions like, who am I? What is life about? And we don't have to sit down in deep meditation like Buddha did. We can do it in our day-to-day work. That's what we are going to learn in the next couple of weeks. And the hunger and gratitude experience, exercise awareness and smile, and how to practice this silence and highlights we'll talk about. And I don't think I have too many more slides. So we are done in good time. Shall we spend 5 minutes in gratitude meditation today, and then we'll open it up for questions. So what I'm going to request you is to sit as straight back in your chair as you possibly can. Push your back as far behind. Sit up straight. And don't let the head rest. That would be my request. And beyond that, really, there is no specific criteria. Let your feet feel the ground. Feel that you're relaxed. And this is not religious, and there is really nothing that I'm going to ask you to do. But for a few minutes, what I'm going to request is just sit and try to see if you can relax your abdomen. Then feel the breath in your chest. Relax your shoulders. Now we'll relax the neck. Relax all the muscles in your face. The whole body is now relaxed. You can focus on the breath as it comes and goes. On top of that, I'm going to ask you to connect with something that you're really at the core of your heart grateful for. It might be a dear one in your family. It might be your child, your grandchild. It can be playing golf. It might be the energy that you have from cooking. It can be anything that you choose, gardening. Connect with whatever makes you alive and that you're grateful for, and let it warm your heart. Think outside it's cold winter weather, and let this warm your heart and stay with that gratitude. If that's a mild smile on your face, that's okay. If it's not there, that's okay. Stay connected with that gratitude. I will stop talking. We'll start that gratitude meditation for about 2 to 3 minutes from here. We can open our eyes. You can try doing what I'm doing, just warming up your hands. And if you're sure your hands are clean, you can put them on your eyes, on your face, and we are done. So there are two things that we have learned or tried today. One is smiling 20 times with reasons, without reasons, when we are watching something funny on the television or when there is challenging times. And the next 2 weeks, you're going to learn again and again why that smiling becomes so powerful. And this gratitude may be the only other thing that is even more powerful. And this gratitude, I want you to start the day with it. The way to do that is don't get out of your bed in the morning until what we did in the last 2 minutes, you're able to find in your heart the warmth. Let that warmth actually move you out of the bed physically every morning, starting today, all lifelong. If you do just that one thing, and then if you can still add, the 20 smiles is just a reference, how many ever smiles you do. Once you really connect with gratitude, that one smile will last all day long. It doesn't have to, we don't have to keep counting. But with these two simple tools, we'll move forward. Now I'll give the third, which is actually the, excuse me, the easiest component, which is hunger. So once you're connected with that deeper gratitude, my request to all of us, unless some of the people in today's session are pregnant, have type 1 diabetes on insulin, or have liver failures, advanced cirrhosis, it should be, if you're not having any of these things, if you're not breastfeeding, then it should probably be okay for you to try being hungry at least 14 hours overnight. What I mean is, after dinner, don't put anything in your body for 14 hours. On top of that, once a week, we request people to try up to 24 hours, which means from Tuesday evening 6 p.m. until Wednesday evening 6 p.m., I drink only water. So I come to work on Wednesday, take care of patients, I look at stress tests and echoes, and that's my life. And then I actually now am comfortable going to play tennis or biking 30 miles to Rocheport and back at the end of 20, 24 hours of fast, sometimes even after 30 hours of fast, but 24 is really good. So if you can try that, not right away, over the next few weeks, that is all part of the self-inquiry. That's why I'm throwing all this right after that gratitude meditation. But that gratitude will give you the confidence or the physical energy, I should say, to connect a little deeper and explore this hunger. So just like we discussed the flow phenomenon, where with your skill of 10 years of learning tennis, I can compete with somebody who's good at it. Like that, the skill that we are bringing to the table is our gratitude for whatever we choose to be grateful for. With that, the challenge we will try to face on an everyday basis is a little bit more hunger. And I'm finding people are doing better. Even people who are thin, who have a BMI of 22. My children are probably BMI of 18 and 20. They are 19 and 11 years of age. And I ask them both to do this. So my son plays national tennis. My daughter is a state level swimmer. And I still ask them to try going without food for one day in a week. I would have loved to do it if I had learned about it when I was 10 years old. My parents are both doctors. And until my 45 years of age, I did not even miss a single meal. But I believe staying hungry is such a simple, intuitive, and most resilience building tool if we do it out of gratitude. That's why I wanted to take a few minutes to talk about it today, so that until we meet next Saturday, you will explore it in your own terms a little bit. Say if you usually have lunch at 12 o'clock, see if you cannot eat it and just keep the food with you and continue to work for a few hours. If you can smile through those few hours. If you're stressed about not eating, that's not good. So that will give you a little more confidence that yes, my body is actually doing okay. We will not hurt ourselves. If the food is there and we are smiling with plenty of water intake, that's all it is. And once you learn this, you will find you are able to help so much of your patients anywhere in the world with what I just said in the last 5 minutes. So I'm going to stop here and we'll take some question answers. I'm here as long as anyone wishes to discuss, and then we'll meet again same time next Saturday.
Sure.
Dr. Chuckalingham, Laurel has a question.
Well, I have a couple comments. I'm so wonderfully appreciative that the medical world is bringing in the psychology side of things. Thank you for that, because it is a balance. With the smile, I want everyone to know that there is research in the psychological side of things that shows when you smile, the muscles actually release endorphins in your brain. So what you are proposing is very important. And when I give seminars, sometimes on mental health, I'll say to people, you know, even taking a pencil and putting it in your mouth also releases that same kind of thing. So if you can't smile 20 times an hour, maybe you can just walk around with the pencil in your mouth. That was a joke. But the second comment I want to make is about the deep breathing.
Now, before you go to the second one,
Yes.
I think we have to do some research. Why not the doctors put it in our, instead of putting the pen in our pocket, why don't we put it in our mouth and walk around?
Yes.
We might do better. We shouldn't put it this way. If you put it this way, it's closer to frowning. If you put it this way, they say it's easy. See, the logical mind will keep finding reasons why this guy is happy. I need to find some reason for it.
Yes.
So we'll get that working with us. So this was what I wanted to talk about next Saturday, but thanks for bringing that today.
Well, and the second comment is with the breathing. When you're feeling particularly stressed or you're frowning a lot, if you breathe in through your nose and then purse your lips like you're blowing a balloon and you breathe out, the pursing also triggers your parasympathetic nervous system to do a cascade of stress reduction. So it's a quick and easy thing to do.
I'm not going into too much yoga details, but what you're saying is just some of those concepts. If you do breathing exercises, pranayama, there is so much benefit. The way I know that is I'm not very stressed at work. Honestly, I love my work. I love working with residents and taking care of my patients. The biggest challenge in my life is on the tennis court when I'm playing with 16, 18-year-old kids who have insane amount of physical energy. So when I'm trying to run around and try to get some points off them, that's when I'm maximum stressed, and that's when I smile more. Smiling makes my body feel lighter. So that's another exercise I want you to try in this 1 week.
Yes.
Whatever work physically you're doing, half an hour of walking, 15 minutes of running or biking, starting today, I want you to do it thinking you're only half your weight. If your weight is 70 kilos, think you're only 30 kilos and do the same exercise. And you come back next week and say, I'm now asking you to do a lot of things. One, smile 20 times, then wake up, get out of the bed only if you're grateful. And then this last thing is, as you're physically or mentally exerting yourself, physically, I think it's first easier to learn when you're physically pushing your body. Just think you're half your weight. I did that when I was training to hike in the Himalayas. I was training and I tried that. It really helped when I thought I was only half my weight. It actually makes our muscles more compliant and able to cope with that physical challenge. And once we learn these simple things, you'll find work stress becomes that much easier to cope with. So we've actually talked about so many things I wanted to say in the next 2 Saturdays, but I'm so glad we brought all these here. So I'm here. Thanks so much for connecting with these beautiful ideas. I'll stop so that others can ask questions.
Dr. Gates, do you have a question?
Yeah, good morning from Baton Rouge, Louisiana. I'm down here at a tennis match for my daughter in the 16th. And I just want to say that out here, outside, we don't wear masks. And it's so nice to be able to smile and have others smile and prompt you to smile. And I'm just wondering what your thoughts are on this, on the continuation of masks indefinitely, and what effect that might have on the smile of physicians that might be in the hospital for, say, 10 hours a day in an area where there are not others that you're able to read the smiles other than in the eyes. And
if you're asking the question, what does the mask do to our smile, right?
Correct.
The mask actually helps us smile better. Because sometimes we are facing with so many challenges at work when it's not that appropriate to be smiling. We have to give bad news to our patients. But even then, what I'm requesting is connect with that consciously. And then your logical mind will follow behind and find reasons for you to be happy. And what people see in your eyes is very, very important. Even without the eyes, you make a phone call without video or anything, just a regular telephone call. And when you smile, how you connect with the person on the other end will be 3 to 5 times deeper. When I said a mask helps you smile, what I meant was many people are a little shy to try to keep smiling all the time. They feel it's not professional or their job isn't right. We are saying that mask actually allows you that little extra freedom. I hope I answered your question. I can go on with this process longer, but we can work around our circumstances and still keep smiling. That smile is the one that's going to keep us stronger so that we can continue our mission, whatever it is, more successfully.
Dr. Chuckalingham, I just want to tell the audience that after the 3 sessions for the next 3 Saturdays, this Saturday and 2 more, we will have these recordings available and the presentations on our website at msma.org wellness. So you can revisit and also share that information with your colleagues.
And ask your friends to come, even if they missed today's sessions. We'll try to make it more fun for the next 2. I will look at more patients who got better. We'll look at more doctors who've been trying all these simple things and how they find life has become so much more fun for them. So that's what we're going to discuss in the next few weeks. But I'm here. We can talk some more if people have ideas that we want to discuss today or questions or whatever.
Dr. Chuckalingham, if you will look at the chat box, there's a question. Let me open. If you can look at your chat box and read that question from Adriana.
Will there be a talk on how doctors within a system can make it easier to reach out to others? How we connect with people, we are definitely going to talk about. That I think is such an important thing. That will be the 3rd Saturday. We'll relate so much better with people in our lives and colleagues, definitely. People who haven't spoken yet, if they want to share some ideas. I know my cousin from India. I saw her name. I don't know if she's still here. Selvi, if you want to share your life story. in 1 or 2 minutes so that people can be inspired. I know how much you've been through. I don't know if you have access to unmuting yourself and greeting our friends here. Selvi, you want to say something? Are you still around? Maybe
Hi,
she-
Anand.
Why don't you
Hello, hi.
introduce yourself and tell us your life in brief so people will know the reason why you're smiling.
I am Selvi, Anand's cousin. I'm a doctor practicing OBG in Erode, Tamil Nadu. I own my hospital. I have a 30-bedded hospital, and my husband is an anesthesiologist. So we do our private practice here. And I know I've been facing the greatest of tsunami, I should call. 4 years ago, I lost my son in a bike accident. After which I developed myself so much. Like I searched, self-awareness, meditation, mindfulness, everything. I read what all is available, and I developed myself. And now I'm like more peaceful, and I accepted the devastation which like thrown us apart. Now, like I'm leading a very peaceful life. I still practice. I do a lot of psychology. I do grief counseling. I did a course in grief counseling from the UK University. And I now do a part-time counseling for all the grievers who grieve like me, who have lost their loved ones all of a sudden, and have a WhatsApp group. And I support them, and I talk to them frequently, and I do counseling over the phone. And it's really like what do I say? I develop myself so much, and I do lot of meditation, mindfulness, and gratefulness. Whatever Anand said, I'm really following everything. I'm really on the flow now, on the present, and how I do cope with life. Thank you.
Despite losing her son who was in medical school, and today you also help doctors in the US. Selvi, through your experience. So we'll do what best we can in our own exploration of our life, and in that process we can help our colleagues and help our patients. And
I know I went through a lot of videos about grief counseling and all that, and I wanted to help people, but in India there is no concept of grief counseling, and no such counseling at all is available for people like us. So I want to take an initiative, and I just form a group now. We have 20 people in that group, and we chat every day, and I help them, and it's a lot of support for myself and for them also. So we even meet in the Zoom. First time we met in the Zoom last week. We share our wisdom and everything in life. So these are not only doctors, from all quarters of life, and I have my patients and like my friends who are non-medicals, and we have people from all walks of life.
So what is the thing that in one sentence or two sentences, what have you learned about life in the last 2-3 years of this self-inquiry?
So much, like I'm not feeling alone now. I know people are with me, and we are journeying together in that profound grief.
That's a very profound recognition.
I selected people who are similar to me. They have suddenly lost their loved ones. So those sort of people only I selected. I put them in I formed a group, and we are all connecting together, and we feel so supported with each other. It's a lot of healing happening there.
Excellent. Anything else you want to tell us by way of suggestions for our group to try?
So in my journey, like this is the most catastrophic thing which has happened to me. So like I started practicing mindfulness and gratitude journal. I maintain every day. I journal every day, and I make 5 points and before I go to sleep. Like I do the gratitude 5 points I write. I have a bedside journal, and I write 5 points for which animate and inanimate things which I'm grateful for. So in that way I'm able to sleep better. My sleep is better. I'm not like in fact I'm doing better even when I do a OBG while so I was getting a lot of sleep disturbance and all that as a doctor, and now I made everything like I set a boundary for everything. So my profession has got boundaries, my friends, my phone calls, everything I put boundaries, even to my family, so they won't be disturbing me after 10:30 in the night, and I get good sleep. I'm better now, physically, mentally, emotionally. I'm able to see, unless my cup of tea is full, I cannot fill others' cup. So that I
Beautiful.
understood, and I'm doing that now.
Thanks, Selvi. One suggestion is this gratitude that we request you to wake up with in the morning is slightly different from the journaling. See, journaling ends up being at the logical level. It's just that can continue for months or even years. What we request you to experience is slightly different because we want to start only with that. And we feel that type of deeper gratitude at this. We need the subconscious to connect with hunger. And once we make that connection, life itself becomes a meditation. That's what so many of our patients have tried. If you have the chance to try little fasting with what I just suggested, you come back in 6 months and you tell us if smiling
Definitely.
and that gratitude in the morning, the first thing that wakes you up, allows you to go a little longer in that day without food. But for a person who is thin with a BMI of 20 like you are, my idea is not to make you thinner. The times that you're eating, you should eat more and healthy and nutritious food. But still, my request will be for you to fast for 24 hours in a week. That is based off aging research. Anti-aging benefit of intermittent fasting is independent of calorie restriction. That's why I request everybody to do 24 hours once a week and 14 hours
Definitely,
every day of the
I'll
week.
definitely try.
And once you connect with that, then you can teach this to people. And this becomes so easy. Other things become more philosophical and take more training. But these simple things, time restricted eating, all that we can teach easily. But to give them that confidence to do it, that gratitude, if once we connect, it makes it a little easier. I'm so
Definitely,
proud
I'll
of you,
come back.
Selvi, and thanks for joining us. Hope you can join the next 2 Saturdays also.
Yeah, definitely, I'll try to. Thank you so much, Manu.
Dr. Chakalingam, I think we have time for one more comment and then we'll wrap it up.
Can I make a comment?
Before that, Liz, do we need to wrap it up or can people hang on for even 20, 30 minutes if they wish to? I'm here, so I don't know about what the system allows you to. Do you need to close it out or?
We do need to close it out.
Okay.
So just one more comment and then
Okay.
they can
Okay,
reach out to
that's
you
fine.
personally. Thank you.
Yeah. My name is Nandu Radhakrishnan, and I was a Columbia resident and now in Houston, Texas. I'm a professor in speech language pathology and a very good friend of Dr. Anand as well. My issues were primarily with weight management, and I put on weight easily, and I used to go on diets, come back, put it on, lose it, and it went on. During the pandemic, when I had to teach from home, everything was online. I didn't have to go to my department or the university. And I had a very good time because I could eat anything that my kids would leave as leftovers, and primarily they were desserts. And for a long time, I didn't realize that I was putting on weight because I did not have to wear my formal trousers. I had to teach online, so right now I'm just in my pajamas. So I would wear a suit like Anand is doing. I'm sure Anand is wearing his trousers now, but I would not. I would just be in my pajamas and teach. So one fine day, the rude awakening came when I had to go to my department and my trousers just did not fit me. I was healthier by 2 more inches. And that was my wake up call. And before that, a year before that, I met Dr. Anand when he visited us in Houston, and he spoke about intermittent fasting. And that was quite fascinating because it took me back to my roots where my parents used to advise fasting once a month or so. So with less time for exercise, because I have to be a faculty in the morning doing online courses, teaching almost the same course twice because I had to be flexible with student schedule. And when my kids are at home in the evening, I had to be their school teacher because they did not get anything from online schooling. So I had no time for exercises. And I thought, maybe intermittent fasting could be my way. And from December till date, I am going on a 16-hour fasting and having an 8-hour window to eat. And I have lost 27.5 pounds as of now, as of this morning. So I would encourage people, and trust me, we call it fasting, but I have never been hungry. I've lost my cravings for sweets, and I can maintain what I eat, and I can balance what I eat. And I'm thankful for what I eat because I know that I have just these 8 hours to eat. And I have never been hungry or felt that starvation or being less energetic. I am much lighter in my mind as well, and I climb up my stairs much faster. I play table tennis competitively with my son. I get beaten up, but still, I try to give him the best competition. So I should thank Dr. Anand for enlightening me about intermittent fasting and getting me through this. My question would be, I am implementing keto diet along with my intermittent fasting. So those 2 meals that I eat, I keep it as a keto-based diet. I was wondering if that is okay or not.
The
Thank
best,
you very much.
the best diet. It's so nice you joined us, Nandu. Good luck. Continue this journey. My suggestion would be to transition as soon as you can to a plant-based whole food diet, which is heart healthy and much less inflammatory than a keto diet. And
thank you very
ultimately,
much.
we are not only trying to look good, we are also trying to protect our heart. And the biggest risk for life comes from heart attack, dementia, stroke, cancer. All these things go down dramatically when we reduce inflammation. And that happens best with calorie restriction, intermittent fasting, and plant-based whole food diet. These would be the best tools. And even more than these 3 is that smiling and gratitude. Once we connect, we can do so much better. We'll talk some more about it. I know Liz wants to close out today. Thank you. Thank you.
Is there any minute for me, Anand? Can I have a word? This is Vasanta Kumar.
Thanks for joining us, sir.
Thank you. Is there a minute I can talk?
Please.
Okay. Sorry about that. I'm also a student of Madras Medical College, where Anand graduated. Maybe when I graduated, he was just born at the time. And his father was my teacher at the time, and he was teaching me the medical things for my final year preparation for the exam. And now I am learning from his son, Anand, about some other things which is more useful for the life. And another thing is, as Nandu said, I met Anand about 15, 20 years ago here when he was a resident. I didn't have a chance to continue that contact, but only about 3 or 4 weeks ago, we met and talked, and we talked and had a talk like this. And I was seriously thinking of the intermittent fasting. For the last 3 weeks, I'm doing it seriously. In 3 weeks, I lost about 3 to 4 pounds weight, and I've continued to do that. And I'm very thankful for Anand. And I'm close. His mother was my about 2 years senior to me in the medical school, and his aunt was about a year senior to me. And they're all very nice people, and I'm glad I came to know Anand, and we'll continue to follow your recommendation, Anand, and please continue doing this good job, and it's so helpful to everyone. Thank you very much.
I'm so glad that you could connect with us, sir. And my only request is don't do it seriously anymore. Just do it out of fun. It's a long journey. We'll continue to enjoy. Thanks so much for joining us.
Sure.
Thanks, Dr. Hagen. Thanks, Ellis. Thanks, MSMA, for helping us do this.